Okay. Welcome everybody to the Stronger Marriage webinar. I'm so excited to introduce our guest today, Dr. Chelom Leavitt. A little bio about Dr. Leavitt is that she grew up in Yakima, Washington with 7 sisters and 1 brother. She attended BYU as an undergraduate in economics and then went to Reuben Clark Law School. She then practiced family and estate law for many years and then returned to get her master's degree in marriage, family, and human development. In 2010, Dr. Leavitt was invited to be a Fulbright Fellow in Ukraine and teach in, I can't pronounce that city or that
Kyiv.
University.
Oh, Shevchenko.
Shevchenko University in Kyiv. Sorry, I was like, I don't know how to say it.
Good, you did well.
Dr. Leavitt received her PhD from Penn State and is now an assistant professor at Brigham Young University, where she studies healthy sexuality and committed relationships and focuses on how mindfulness during sex may be associated with positive outcomes for both men and women. Dr. Leavitt recently published in the Journal of Sex Research on how women's sexual response cycles are more variable than the traditional models suggest. And she published in the Journal of Sexual Medicine on the, I don't know about this word either,
Curvilinear.
Curvilinear. The Curvilinear Association. You should after I introduce you should explain what that word means.
Okay, I will.
Between women's orgasm and sexual and relational satisfaction. Dr. Leavitt is married to David Leavitt, and they have 9 children ranging from ages 32 to 5 years old. They also have 7 grandkids. Well, that is such a full life, such an amazing bio. I think that's one of the coolest bios I've ever read.
You're kind.
So today the Dr. Leavitt's presentation is titled Sexual Mindfulness, where she'll be talking about how the simple practice of staying present in the moment and using curiosity instead of judgment can improve the connection between you and your partner and your sexual experience together. Dr. Leavitt also wants to encourage you to use the chat throughout. You can ask questions in the chat. It's enabled. I'll be keeping an eye on questions as well, so we can hopefully answer questions throughout. But we also will be holding a Q&A at the end, so you can save your questions for then if you like. And there's an option to submit your question anonymously, if you prefer to submit your question that way. I'd also like to add really quick before we get started that this workshop is approved for 1 CEU, and you can fill out the survey at the end of this webinar. It pops right up when you exit out, and it's one of the last questions on there where you can request your CEU. This webinar is also recorded, and everybody here today, everybody registered, will get a link to the recording tomorrow. So with that being said, thank you so much for being here with us, Dr. Leavitt. I took a class from Dr. Leavitt a couple years ago when I was at BYU, and it was just one of my favorite classes ever. So I'm very, very excited to have you here. You just are fantastic. So everyone buckle up.
Thank you, Camilla. I really appreciate that introduction. So I mean, if I were first to tell you about really one of my favorite research projects has been the one you mentioned about orgasm and the difference between how men and women experience orgasm, and that we've always known, well, for a long time, we've known there's an orgasm gap, right? Men much more consistently achieve orgasm than women. Different studies will quote different orgasm gaps, but we know it's right around, men are orgasming at about 95% of the time and women about 65% of the time. And so I just had this, question. I had to know what might be some of the reasons that we see those differences. And so the research article that Camilla was talking about, we found that men reported more sexual and relational satisfaction the more consistent their orgasms were. And that kind of makes sense, right? We would think the more pleasure we're having consistently, the more we'll feel satisfied with both the relationship and with the sexual experience. But what was interesting was that women's association between orgasm consistency and relational and sexual satisfaction was what we call curvilinear. So it reached a certain point where it wasn't linear anymore. It started to kind of taper off. And what we found was that women who were orgasming about 61% of the time or more reported high satisfaction in both their relationship and their sexual experience. So we, as men and women, we might look at orgasm a little differently. If we have a high quality relationship, some women feel that it's not necessary to orgasm every single time, whereas men may feel a more linear connection to their satisfaction. So we can talk about that another time, but yeah, I think that's an interesting study. But today we're talking about kind of my main area of research, which is being mindful during the sexual relationship, and how does that impact my relational and sexual satisfaction or flourishing even, and how does it affect my physical functioning. And what's interesting is we have enough research out there from stuff that I've done and a few other people that we know there are really positive outcomes when we slow down this process and are a little more intentional, a little less judgmental, which the opposite of being judgmental is being curious, right? If I can be curious about why is it that I'm experiencing sex this way or that way, or that my arousal takes a certain pattern, or just curious about anything that's going on in my sexual interaction, right, with my partner. So let me just open up my PowerPoint and let's go from there. So, I think I need to screen share first. Here we are. Okay. So I'm actually taking this I do a course teaching couples about sexual mindfulness, because although I can explain the idea and it's like, yeah, that makes sense, it's not as intuitive as we might imagine. And so what we found in my research is that just a short intervention, and it's about a 6-hour class, seems to create significant improvements in a whole host of outcomes for couples. Things that we've measured are they feel more emotional connection, they feel more relational flourishing, relational satisfaction, right? They feel like they're growing in their relationship. They're feeling a sense of completion. Their sexual harmony and sexual satisfaction increases. And interestingly enough, in some of the interventions we did, well, in fact, in every one of the interventions we did, we saw sexual behaviors increased the more mindful people were. So there was more kissing, there was more sex, more all sorts of sexual behaviors. So that was pretty interesting, right? Because we start feeling rewarded from our sexual relationship. So of course we want to engage in it more. It's not frustrating. It's not off-putting. We feel like we're being seen and known. And so that changes the whole interaction of the sexual experience. So I start off by kind of giving a little history of how this curriculum came to be. And what happened was I was actually in my PhD program. And for another course, I was at a presentation about mindfulness. And what was interesting was that as I went through this explanation of how mindfulness was helping teacher-student relationships and people who were suffering from anxiety or chronic pain, all these other things, I thought, oh my goodness, this has to apply to sex, because sex, we know, is qualitatively different than the rest of our everyday life, right? We feel heightened anxiety during sex. Even if we're in a good, committed relationship, we feel a little more anxiety. After all, we're sharing our naked body, right? We're opening up parts of our emotions and being quite intimate and vulnerable with this person. So of course, we're going to feel a little more anxiety. We may even feel anxiety from the increased arousal. That may create a little anxiety for us. All sorts of reasons. So I thought, wow, I've got to see what people are doing on this. And no one was really doing anything at the time. So I created a measure that looked at, that measured how mindful someone was during sex, right? Because I might be mindful in my everyday general life, right? As I'm writing a paper in my office, or I'm walking across campus, or I'm eating lunch with a colleague. I could be mindful in all of those activities. But then when I try to apply that mindfulness to sex, it might just fall apart, right? Because of this heightened anxiety. So, first of all, could we measure that? And yes, we could. We saw a clear distinction, and we saw that it was consistent and that it was associated with outcomes. And so the next question was, can we teach people how to be more sexually mindful? And again, the answer was yes, overwhelmingly yes. We saw people who initially, this was a little bit of a struggle. And we know as we start practicing mindfulness, it's likely to cause a little heightened anxiety for the first couple weeks or month even. But as people kind of moved through that and were able to integrate their daily mindfulness into their sexual interactions, we saw improved functioning, improved satisfaction. And it was really quite a meaningful experience to see this happen in couples' relationships. So some of the details of the program, we don't only teach about sexual mindfulness, we kind of have to build a foundation. And like probably most of you know, with relationship education courses, they don't always focus on sex, right? We'll focus on the health of the relationship, communication styles, those sorts of things. So we knew we had to lay a little foundation on some of those things to make sure that couples had a good set of skills to apply to their sexual relationship. So we definitely talk about healthy sexual relationships, the meaning of sex, the emotions of sex. And interestingly enough, we realized we also had to teach about sexual anatomy. So often we just assume that sex is going to be intuitive to us. In so many cultures, it's not just US culture, because I've taught this all over the world. In so many cultures, we are lacking in just a basic understanding of the differences between men and women and the details of our sexual anatomy and the function of different parts of our sexual anatomy. So we give a little crash course on sexual anatomy as well. Particularly, we focus on sexual communication. Sexual communication has one of the most significant contributors to sexual well-being. And what we found was that the more mindful people were, the more easily they communicated about sex, right? It wasn't this taboo topic as much as it had been. They could kind of take that anxiety down a notch and talk about nuances in sex, like what their preferences were, what they liked, what worked, what didn't, what we should emphasize more. And so that's such a key component that we know mindfulness contributes to. And then we also talk about some things that might cause a little hitch in our sexual relationships. Some of the myths or meanings that we've bought into about sex that we know really impede a full understanding of our partner and ourselves, right? We have to understand ourselves before we can communicate that to our partner. And if we're kind of fuzzy about what our preferences are, what our likes and dislikes, and we're a little inhibited about being able to talk about those things, or if we have, misunderstandings about them, it's really going to impede how we connect sexually. Okay, and then we introduce meditation because mindfulness is kind of this big, broad way of being, right? It's being present in the moment. with a quality of presence, right? Intentionality, attention, and intention. Those are both really important. But then it also adds this other component of non-judgment, right? And the antidote for that is curiosity. However, the best way for you to improve your general mindfulness is through the doorway of meditation. So meditation, you don't have to meditate to be mindful, but it's a really effective skill to improve your mindfulness. It helps you slow down the busyness of your brain and focus on your body, right? Just be present with your breath. Let your brain take a little rest. And we know just a small amount of meditation practice seems to have a huge impact on the rest of your life. So if every day you can meditate for 3 to 5 minutes or even 10 minutes, what we see is a pretty dramatic increase in your mindfulness skills. Okay, and then we also talk about some other mindfulness practices. So that's kind of the details of the program. I'm not going to be able to go through all of that, right? Because it's a 6-hour course, but I'm going to just touch on a few of these things to give you a taste of it and then give you some resources for where you can learn more about this. All right, so we kind of go over the basics of a relationship. And what we see is that having a sexually whole relationship kind of has 3 components. It has the emotional, the physical, and the meaning, right? And being vulnerable and authentic kind of contributes to that meaning aspect. And so, as you would expect, emotional is just a sharing of thoughts and being honest about how you feel. The foundation is really friendship and emotional intimacy. We see repeatedly in research that the emotional connection a couple has is the foundation of their sexual experience, right? In fact, I really like it how one person said, you really have to be able to share your soul if you're going to share your body effectively. And so can we tell them our hopes and dreams, our weaknesses, all of those things, which kind of touches on vulnerability and authenticity. But so often the emotions of the relationship are where most couples are struggling to really share with each other. Okay, and then obviously the physical, right? Hugs, kisses, holding hands, all of that. It really enhances connection, but our body is the vehicle through which we create this connection. Okay. And then vulnerability is sharing things you might not share with anybody else. This relationship, this sexual relationship that you have, kind of is set apart from other relationships, right? We're divulging things about ourselves, and hopefully they're authentic, right? We're really showing everything about us, and kind of getting rid of any artificiality or the masks that sometimes we wear, right? So that's where vulnerability and authenticity come in. They're so critical. All right. And so one of the differences that we talk about are differences in anatomy. And it seems pretty obvious, but it's interesting how for so long in the history of sex research, we kind of just researched men and what men's sexual response cycles were and that sort of thing. And then we just kind of slapped it on to women and said, well, women should be the same. And it really has only been in the last 15 years that we've started digging in to the differences, the anatomical differences, which of course are obvious, but then some more nuanced differences in hormones and response cycles. Some colleagues and I did a study on men and women's response cycles and found that actually there was far more variability in women's sexual response cycle than there was in men's. Men certainly had some variability, but there were only like 3 categories of how their sexual response cycle played out, whereas women had 6. different response cycles, 5 of them being perfectly healthy. And yet too often as men and women, we assume that sex has to look one particular way. And that's just not so, right? So we kind of have to let go of some of these myths that we've bought into or that we've been fed and start being a little more thoughtful and trusting our own process and tuning into our body so that we can understand what works best within our relationship. And for me in particular, and understand we don't need to be comparing with other couples or other women or other men. Okay. So obviously men have much more familiarity with their anatomy. Their anatomy is mostly on the outside of their body. They're used to touching to when they clean or go to the bathroom, whereas women, not so much. Women have to make a little more concerted effort to understand and know about their anatomy. All right. And so then we talk about sex and communication, right? We know this is one of the most important elements of a healthy, vibrant relationship. In fact, Peggy Kleinplatz, Dr. Kleinplatz from Canada, did some great research under the title of optimal sexuality. And she interviewed couples who consistently reported not just good sex, but like really great sex. And she interviewed them to find out what some of the commonalities were in their relationships. And what she found was that communication was right at the top of the list. That not only did they have good communication, they had extraordinary communication, right? So they could really divulge things with each other and they felt safe and secure. And they were able, in fact, some of them described it as transcendent. They could share so much with their spouse that they felt, this vulnerability that was safe and rewarded. Okay. And so one of the key components that we see from this and other studies is that we really have to be gentle with each other. When we start communicating about sex, we naturally have a lot of insecurities. So we have to be gentle with each other. Assume the best, right? If one partner is pretty consistently initiating, and maybe that gets tiresome for the partner being asked, they feel like, I never have a chance to initiate because you're always initiating. Assume the best, right? And maybe ask, why is it that you love sex, right? Ask gentle questions that maybe can get to a deeper level of what's going on without accusing, right? Without making kind of these harsh judgments of each other. So we communicate love and gratitude as much as we can. And when we need to bring up something, we definitely need to bring it up, right? We're not saying shy away from hard subjects. We're actually saying address hard subjects, but do it gently, right? We can just say, I'm just noticing this imbalance in our relationship, and it's kind of making me feel a little unseen or unheard. So I wonder if we could have a conversation about that, right? That's a way of slowing down these feelings that we have that something is out of balance. Okay. Always create safety, security, and an atmosphere of love, right? Because this really is such a sensitive topic for most people. We feel pretty vulnerable right from the get-go. So if we get turned down, it can be pretty devastating for many people. And so we have to, when we turn down or say, I can't right now, I'm fatigued or I'm just not in the mood. One nice thing is to say, I find you attractive. That's not the issue. I am just, and then explain whatever you're experiencing. And then say, how about we plan some time for the weekend or tomorrow evening or whatever, so that our partner knows we're not turning them down. We're not trying to squash their generous initiation of sex. It's just not what we're feeling right now. Okay, so this is one of the activities that we have couples engage in. We ask them to just take a minute and think about what sex means to them, right? Why do you usually have sex? What do you hope to experience during sex? Are there meanings that you give sex? Is it for an expression of love? Is it for making up? Is it just for fun? What are some of these things? And asking your partner that as well kind of helps give this better understanding of what sex really means in your relationship and why it might be used in a particular way to create different elements that contribute to your relationship. Okay, and another thing we do a lot of experiences, right? A lot of meditations or mindfulness practices. One we do is a body scan. If you have never done a body scan before, this is a really nice way to kind of drop into your body and get a little connected. A body scan is kind of like just this little radar that's kind of going from head to toe or from toe to head. And you're just checking in with each part of your body. What do you notice as you slow down and think about your toes and then move on up? And maybe how does your abdomen feel, right? What kind of stress are you carrying in your neck and shoulders? And as you notice that, it's interesting how relaxing it is to notice it and then take a few breaths, kind of let go of the tension in that part of your body. Just kind of like as you exhale, you're just pushing out the tension, pushing out the anxiety. And what's interesting, this is a really nice thing to do right before bed when you're trying to settle down. If you're anything like me, my mind ruminates a little. And so I have to be purposeful about slowing my mind down, taking this time to relax my brain, right? And as we do this on a daily basis, we start to notice all sorts of cascading effects in other areas of our life. Most especially, as you would imagine, most especially our sexual life, because sex, after all, is a sharing of bodies. And so the more attuned we are to our body, the better our body will function, but the better we'll feel this emotional, intellectual, relational connection with our partner, a spiritual connection. In fact, my research hasn't examined so much the spiritual connection, but there are others who have examined that. And what we see, Peggy Kleinplatz actually was one of them. And people who were more mindful actually had more, reported more spirituality in their life. And like I said before, a sense of transcendence, right? Being at one with the creator, whatever that meant to you. So this is a really beautiful practice to try for no matter what no matter where you are in your practice of mindfulness. Okay, and then we look at sexual mindfulness, right? What does it mean to actually be mindful during sex? And what we see is that being present and aware is a little bit hard. It's a little bit hard during sex, like I said, for all of those reasons. Heightened anxiety, we're more judgmental of our body. How do we look? Are we doing this just the right way? But when we're mindful outside in our general life, we can start to bring that in to the sexual relationship. And we won't get it very, very well at first, but we teach a few techniques and a few kind of experiences to try to practice at home with your partner to kind of increase your ability to stay mindful, even in this heightened sense of arousal. Okay, and so the key really is to slow sex down a little bit. Can I be present with my partner? Can I just notice touch, smell, my taste, right? How do things sound? What thoughts maybe come into my mind? What emotions arise? Can I slow sex down so that I don't just zoom right past all of these things, but instead I notice them. I'm intentional about what it is I'm experiencing. Okay. And we know that this ability to slow sex down is often uncomfortable for couples initially. And in fact, some couples will report that it kind of makes them giggle, right? That it's like, wow, this is so ridiculously slow that it seems weird to me. But the more we can practice that, it's not to say that every single time you have sex, it needs to be this slow practice of sex. But if we do it often enough, we're gaining skills that most people never tap into, right? So many people just kind of zoom right past this type of arousal, this type of sensation, because they think that the purpose of sex is to have an orgasm, right? The goal of sex is to have an orgasm. But in reality, we know what the goal that the real benefit of sex is to create intimacy in the relationship, to create this sense of connection, right? That orgasm is just kind of, it's a nice benefit from sex. But even if it doesn't always occur, we know couples report feeling pretty connected to each other when they're practicing sexual mindfulness. Okay, and we know this is also super important as you age because bodies don't necessarily act the same way at 40 or 50 that they did at 20 or 30. And so slowing down and being more intentional and creating a quality of relational interaction, we know really benefits not only the young, but a lot the middle-aged. And so this is just an important skill for your whole lifespan. All right, so, and I just wanted to share with you a couple of exciting things that we're doing with this program. Not only have we done the pilot program and a longitudinal intervention that showed long-term effects, but we've also been able to kind of hone in on some different populations that may have heightened risk in their sexual experience or more anxiety in their relationship. And so we have done a sexual mindfulness for Black and interracial couples and found positive results. We are working on one right now for sexual assault survivors. So people who have had trauma in their childhood or as adults, can being mindful in sexuality kind of help them alleviate some of the anxiety and stresses that come along in a sexual relationship because of that earlier experience. The sexual mindfulness measure, has been validated in French, Iranian, Polish, Ukrainian. There's a few others that we've added just in the last little bit. And then I just did a training with therapists in Bangladesh, and we have one planned for therapists in Iran. So this is a program that is really resonating with people. I have shown in some of my research that people who are more sexually mindful have more frequent sex, they have more consistent orgasms, and all sorts of higher communication levels, all the things I mentioned before. So there really haven't been any negative side effects from this. It can be frustrating for couples at first, in the first couple of weeks that they're practicing this. But what we see down the road is just a host of really great outcomes, really great skills that they're developing. And so a few comments from our most recent intervention. It was with the Black and interracial couples. One couple said, "What I loved the most about this class was the fact that it helped me and my spouse in understanding each other and working together to make our sexuality even better than it was before." So I will say this, all of these programs have been for pretty well-functioning couples who just kind of want to boost their sexual experience with one another. We are working right now on a program for couples who are experiencing clinical distress. And so we would probably have an extra component about moving through trust, establishing trust again. That's still a little ways off. It'll be another year before that one comes out. But it's pretty exciting to watch how slowing down, being more intentional, and creating a sense of awareness and attention really seems to let our bodies kind of heal in ways that we haven't really tapped into, especially with our super busy, multitasking culture. This skill is becoming so much more essential. All right. Another couple said, I like the diversity too, because, you get new, fresh ideas from different people. There are a couple of people from different nationalities and cultural backgrounds, and it's good just to interact with different people. So even beyond just the couple, people were sensing this acceptance in a group. We try to keep it to about 8 to 10 couples at the most. So it's a pretty small group, and they're not really encouraged to interact with each other, but just hearing other couples say, yeah, I struggle with that too, and this is working for me, or here's one thing we tried. It's a really nice environment for us to be much more accommodating and supportive of each other.
There's a couple questions in the chat
Oh,
for
yeah.
you.
Okay, let me go to that. Okay. So, have there been any studies examining mindfulness as a therapy for ED? Yes, there has. I'm so glad you asked that. Up until just probably, I think this came out about 6 months ago, there had been none for men. Like, how did mindfulness benefit men in particular? My research did look at both men and women, but it didn't examine sexual dysfunction. But another researcher did look at just mindfulness in general, and did it help men who were struggling with erectile dysfunction? And yes, it did. And there's a couple other therapists who have kind of given some anecdotal evidence that it seems to be helping their clients pretty dramatically. Okay, the next one, I have a client whose wife likes to have makeup sex, and he has a refusal to do it as makeup sex. How can I challenge this thinking? Oh, it's a great question. I think it's important that when we're communicating, we kind of understand that we have to dig down and understand our partner's perspective, even though it may seem really contradictory to ours. I like this idea that conflict, right? This would represent conflict. Conflict is the opportunity for intimacy. Maybe he could kind of ask why makeup sex seems to be attractive, or a nice way to create an open door to find resolution. It may be that she feels particularly connected emotionally in sex. And so that might be a way for her to open the door and then start talking about some of these other issues that they have. So yeah, I guess I would just say, maybe see your wife's perspective. Maybe let's dig down and understand why makeup sex is a nice vehicle for her to work through conflict in their relationship. Is there some guide with exercises or examples of what mindfulness means? Yeah, I'm going to give you my website. And I have a number of blogs on different mindfulness activities. As much as we can, we try to give information on the website. There are some things that we only teach in the course because they really have to be explained thoroughly so that people don't misunderstand and then create problems in their sexual interactions. But we do give an awful lot of information on my website, and I'll give that to you at the end of this presentation. Is there a good resource for understanding what a female orgasm is like, or how to know if the female is having an orgasm? Yeah, so female orgasm is really a contraction of, what's interesting is both men and women describe orgasm the same way. There have been a couple of qualitative studies that just asked both men and women to describe what orgasm felt like. And interestingly enough, it overlapped almost entirely. So what men are experiencing physically, so are women. We give slightly different meanings to orgasm as men and women, but the physical experience is pretty similar. So, right, it's a pulsating of the genital area muscles, and we know there's a little more blood flow. Women can have multiple orgasms, right? So for women, this is one main difference. Women can feel this pulsating, this pretty rhythmic pulsating that's very pleasurable for repeated cycles. Whereas men, after they have kind of one episode of orgasm, they go through what we call a refractory period and have to wait until they can have another orgasm after going through the arousal cycle. So I would say female orgasm looks the same as male orgasm. I know a lot of women will say, I don't know if I had an orgasm or not. My guess is if you're unclear about it, you may not have. You may have felt heightened sensation, but you haven't had that kind of explosion of pulsating muscles and the heightened pleasure that comes along with that. What's interesting is we know for women in particular, there is a gap between first sexual experience and first orgasm. And that gap throughout a number of different studies has been 2 to 3 years. So sometimes women have to get to know their body a little bit and their arousal process before they kind of learn how it is to get up to that orgasmic threshold of arousal. Okay, I think that's all the questions. Let me just go. I think I just have one more slide, and then I'm happy to answer any questions. Oh, that's it. That was my last slide. So I'm going to stop sharing. This is my website. I also have an email address that you can use to ask any question. I think this is on my website as well, so you can access it through my website. You can sign up for newsletters. We share the podcasts, the latest blogs that we have. And I try to keep updated on my research. It's been a little hard lately because we've been publishing quite a bit, but some of the latest research, I do a lot of work on orgasm and then sexual response cycles and mindfulness. So all of these things kind of combine, right, to help us know what's contributing to great experiences. That's my whole focus is I want to know what is adding, what's a benefit, what's a protective factor in our sexual relationships. Okay, I'm going to stop sharing. And it looks like it's gotten really dark in this room. So I'm going to turn on my light, and then I'm happy to take any questions. Okay. Okay, so I see another question. For women, is there an average length of time to achieve an orgasm? Okay, other than what I just talked about, right, before you have your first orgasm, for most women in intercourse, right, or when we're actually having a sexual experience, doesn't have to be intercourse, right? It could be a whole host of different sexual behaviors, right? Oral sex, outer course, just any type of arousal. We know women typically, well, on average, need about 20 minutes of stimulation before they reach orgasm. And for women who are multi-orgasmic, it may take even longer, right? Because they're going through this pattern a number of times. So a lot of what's interesting, when I did some research on the sexual response cycle, the one I was telling you about, where we found 6 different sexual response cycle for women, 3 for men, a pretty common contributor to those who were in the highest levels, the highest patterns of arousal, was that they spent more time in sex, right? And in fact, there was a 10-minute difference between the lowest level of arousal pattern and the next closest one. And there was about 20 minutes difference between the lowest and the highest, right? So that's a lot more time spent on just the arousal process, just being present with each other and kind of stimulating the clitoris, stimulating, the specific and non-specific areas of the body, right? Specific being genitals and breasts for women, just genitals for men. The non-specific being our neck, our lips, kissing, your forehead, your abdomen. All of those things are non-specific. And one interesting thing is we know with really like skillful lovers, you start in the non-specific. You don't just dive right in to intercourse, right? Or to touching the clitoris or the tip of the penis. Instead, you start kissing, you hold each other, you cuddle, you kind of gradually move into that. As our arousal increases, then skillful lovers can move to these more specific areas. And it becomes less irritating than if we just dove into really heightened arousal of specific areas. Okay, how do we sign up for your class? You can just email me and I will tell you when the next class is. I am not sure when the next class is. I'm right in the middle of one right now. And so we'll schedule one soon and we will advertise that on my website. Outer course, not familiar with this term. Can you expand? Okay, so intercourse is when the penis enters the vagina. That's intercourse. Outer course is maybe where the penis is on the outside of the woman's body, but it's still arousing, right? And they're still creating the friction and the arousal through just being on top of each other or beside each other. So it's not necessarily penetrative sex, but it's still touching and arousing both the genitals of both people. All right. How much does my course cost? Not much right now, mostly because we're just trying to get the word out and really spread the powerful and impactful process of what this course is actually doing for people. So it's been right around $40 to $50. We're just at this point just trying to pay the facilitators, and we give you a nice booklet that you can use as a workbook. And so it's pretty low cost right now, and that's per couple, right? And we do insist that both members of the couple come because it's much more effective if we're teaching both people how to go about this process. And in fact, we've actually done research on the actor-partner effect, right? We know that the person practicing sexual mindfulness is certainly going to have benefits, but we actually have shown that my partner, right? If I'm practicing sexual mindfulness, my partner reports improved well-being as well, even if they're not practicing sexual mindfulness. So what's happening is we're changing our inner environment, which necessarily changes our outer environment, how we interact with our partner. So it's really powerful. Okay, let's see if I'm going to catch up to the questions. How do you think masturbation to figure out your body as a female is wrong as a Christian? Okay, this is a great question. And I think that sometimes we get kind of caught up in terminology. And if our goal in sex is to create a meaningful relationship, right, to strengthen those bonds as spouses, what we talk about in my research is that sex is other focused, right? If I am in this loving, committed marriage and I am trying to benefit my marriage, then as a female, especially, we know women, like I said at the beginning, sometimes women don't know their bodies, their genitalia is mostly internal. And so they're unaware of what their arousal pattern is, what they find pleasurable. And so what's nice is that you can discover that and teach your partner. Now, if you feel like you want to avoid this, I don't even consider it masturbation. What it is knowing yourself so that you can teach your partner. You can do it with him, right? As you're learning about yourself, you can maybe either guide him to touch you in a certain way so that you understand what your arousal pattern is, or touch yourself so that you can teach him how to create pleasurable sensations and arousal for you. I hope that answers your question. Do you recommend toys to clients to use? I don't, but that's not to say I don't think that couples can't use that. I think that the important thing is that they're communicating about why they would want to use a toy, right? Is it something that they just think is fun? It's creative. It's something they wanted to try. And so what I always talk about is creating consensus and making sure there's consent by both partners, and that we're creating a sense of growth and development. And so talking about the meaning of why we want to try a new position, or why we would want to use lingerie or a sex toy, that's probably the more critical part of this sexual relationship, is really communicating about it thoroughly. The why is so essential to development as a couple. Is your goal to have every time be mindful, or just sometimes? I would say it doesn't need to be every time, but I think what a lot of couples are finding is that they want it to be mindful every time. It feels differently. It is far more intimate. But if you only have time, right? Crazy, chaotic life schedules, children, jobs. If you only have time for a short little interaction, that's great too. Take what you can get, and still maintain that connection with each other. So important for us to prioritize sex. This is a meaningful way that we connect with each other. And so we do have to prioritize it. So not every time can be a 40-minute, hour experience. Sometimes we just have time for a little quickie, and that's great too. It helps us reconnect with each other. Okay, do you have any advice for couples dealing with vaginismus? Yes, we know from lots of research, not my research. So, but Lori Brotto does a lot of research on painful sex, right? And what she has found is that being mindful actually has a huge impact on it, right? Because we're being much more aware of the woman's body and the tension that she's holding, right? Definitely we have to use lots of lubricant, take all the stress off of penetrative sex, and start kind of slowly working into this. Again, slowing down this process so that the moment there's pain or discomfort of any sort, we talk through, what is it that you're actually experiencing? Are other thoughts coming to your mind? Stay present in this moment. And what we know is that I can't even tell you how many studies now have shown positive results for a majority of women who experience pain of any sort during intercourse. Do you have an upcoming class for clinicians? I will next semester. Again, just check my website. I just barely did one this weekend. Those are a little more intensive. And I will put that information on my website, or you can just email me either at my BYU email or my Ask Chelom at Gmail email. All right. Is there an in-person course or are there virtual options? At this point, we've only done, well, that's not quite true. I've mostly done in-person courses, mainly because it's such an intimate topic that you kind of want to have that personal feel. But when I've been teaching therapists outside the country, especially during quarantine, this pandemic, we have done some virtually. It's a little more difficult. So it's not my favorite way to do it, but it can be done virtually. Also, what times and days of the week has it been historically? All times. This one that I'm doing right now is on Monday nights. I usually try and work it around people who have work schedule, that work a 9-to-5 job. So we usually do it in the evening. What brands of lube do you recommend? I don't recommend any. I would say just go on a little shopping spree and buy a whole bunch of different ones and kind of try it out, because like I have found in my own research, there is such variety in how people experience sex that to just say there's one right or one best, it's just really misleading. So kind of figure out what it is that works for you. Be creative. That could kind of be a fun date night, is to try out different types of lubrication and see what one you both prefer. Has there been any research on mindfulness during sex where one partner or both have experienced sexual abuse or trauma? Yeah, there has been. Again, this has been by Lori Brotto, and it's just been mindfulness, not sexual mindfulness. So just, can mindfulness in my everyday life kind of transfer to my sexual experience if I've had trauma in the past? And what we see is there's really good results to show that for a large portion of, and it's only been women, I have to say, there haven't been any men in these samples of sexual trauma. So women who have had sexual trauma in their life, I know some of it has been childhood and some of it has been more inclusive, but they've found significant results in every study that I have seen. So it's really promising for a lot of these things that create anxiety and kind of this dysregulation in our mind. We know women kind of separate their mind, what they're experiencing cognitively, and what they're experiencing in their body. And a lot of that contributes to this inability to orgasm or pain during sex or all sorts of dysfunctions, low desire. And so what we see in mindfulness is that we start to align what we actually know in our mind and what we're feeling in our body. So it's pretty powerful, right? We've actually done some fMRI work, looking at what parts of the brain are lighting up when we're mindful, and that we're much more attuned to what's going on in our body. So pretty great stuff. This is an exciting field to be studying in. Okay, what happens if the woman is only able to orgasm if she's really concentrating and blocking everything out that is happening? What is happening? What happens if the woman is only able to orgasm? Oh, okay. So I think, I'm not sure if I understand the question, but if women are like hyper focused on orgasm, we know that oftentimes that makes orgasm even more elusive. If instead we kind of let go of like, okay, I've got to get to this arousal level so that I can orgasm, so that I can be successful. If instead we just slow it down and think, okay, how does it feel that my partner is touching me? What's the temperature of his body? What's the temperature of my body? What am I feeling in my genitals? What am I feeling in the rest of my body? Can I just stay present with what's happening right now? And we know that as people slow it down and they're not looking like, okay, I've got to get to this heightened arousal, their bodies start functioning better, right? Their bodies aren't filled with this anxiety. Anxiety is the enemy of arousal. And so the more we can reduce anxiety, the more our body's going to be able to respond to what it is we're experiencing. Okay. How to balance LDS values and sexual experiences, as it feels taboo to know what is acceptable versus not. It's such a good question. I teach a healthy sexuality in marriage course on campus, on BYU campus. And so what I think is beautiful about the LDS doctrine is that with healthy sexuality, our doctrine really aligns perfectly. Um, we were designed as sexual beings, and for a really powerful purpose, to bond with each other in marriage, to create children. That's another purpose. But the main purpose probably being this consistent bonding so that we can have strong marriages that can kind of glide over the bumps and bruises of life. So important that we understand that we not create these myths or these unhealthy attitudes. So much of our culture creates this taboo that our doctrine does not. Our doctrine actually honors the body, really reveres it, talks about this is a gift. This is why we came here in mortality, to gain a body. So let's learn from it. Let's, honor these bodies and the sharing of bodies in this most sacred way. Okay, I'm just going to ask Camilla, is it okay if I answer a few more, or should we end?
Yeah, let's do one more question.
Okay. All right. So, how to achieve arousal with antidepressants? Like, I'm assuming, like, while you're taking antidepressants, any key ideas to sexual connection while medications are a challenge, right? We know that's real. Right. So we know the nice thing is there's some variety of antidepressants that impact sexual outcomes a little less, Wellbutrin being one of them. But I would talk to your doctor, because we know that antidepressants can have a huge impact on sexual desire and sexual arousal. So this is something that you really have to be careful with, and talk with your medical provider to understand if there are other options out there for you. If you're being negatively affected, there are probably other things you could try. I would definitely add, I would not get off your antidepressant, but I would add a mindfulness practice. There's good research to show that mindfulness can kind of be this second layer of helping with a host of, anxiety sometimes is comorbid with depression. And so seeing how that might work for you in your own circumstances, working with your medical provider, and adding on a practice of mindfulness. Okay, it's been such a pleasure to be here. I know there's a survey that Camilla sends out afterward. I would really love it to get your feedback, to get any other questions or whatever other information we can glean from that to help improve presentations in the future. Thank you so much.
Thank you. Thank you for mentioning that about the survey as well. That was just fantastic. So well put, so well done. I'm seeing a lot of thank yous in the comments. Lots of people who are interested in taking the course or whatever course you have coming up at some point. Yeah, that was just fabulous. Thank you so much. And truly no worries at all about going a little over time in the questions. And I know there's even some questions in there that weren't we weren't able to get to.
Yeah, feel free to email me with those questions and I'll do my best to answer.
Okay, perfect. I was just about to mention that. I was like, if you want, I can send your email when I send out the recording to everybody tomorrow. I can also include your email.
Yeah, just maybe send out my BYU as well as the Ask Chelom and my website, which is just my name, chelomleavitt.com.
Okay, awesome. Okay, that was, I've already said that was so great.
Thank you. Thank
All
you.
right. Everyone have a good night. Bye.
Bye-bye.